Good morning, everyone. My name is Sharon Combs with Knowledge or Nonsense. Today, we are going to jump right in. We're going to be talking about some of the things as it relates to staffing models, as it relates to operational models, some of the changes we've seen over the past 3 decades, why those changes occurred, and what we can look forward to upcoming within the sterile processing world and other industries as well. Just some of the changes in hopes that we can provide some knowledge and free up some individuals from nonsense. I have with me Diney Payne, Karen Cherry, and LaWayne Perkins.
Morning.
And yeah, good morning, everybody. How are you guys doing?
Great.
Good. Pretty good.
What's it like out there on the East Coast? Is the hurricane? Are you guys getting rain yet?
We're getting a lot of rain, and it's actually going to hit North Carolina on Monday, Sunday night, between Sunday and Monday. But we're getting a ton of rain.
Oh, okay. Well, wow. If you're getting a ton of rain already and it's going to hit, enjoy that. Enjoy that rain you're getting now. Hopefully, it won't be too bad since you're inland a little bit.
Yeah.
Where you ladies, I think we're all in Texas, so I kind of know how y'all's weather is. A lot is going to be going
sunshiny. Yeah,
right, sunshiny.
Really nice.
All right. Then yeah, without further ado, maybe let's just get into some questions. A lot of people, there've been a lot of changes over the past few years. Lots of the training had to deal with how many generations may be in the workplace, because that was a change for so many people to be working at once. A lot of people who are even retirement age now can't afford to retire, which may be a bit of a bump in the road in a time when there are going to be more employees, more people and candidates for jobs than actually jobs. Wait, let me put it like this: typical jobs available. There are ways to bring in income. So what are some of the, just right offhand before we jump, have to talk to our IT people about that. Yes. So what are some of the changes we have seen?
Well, I can tell you, operationally, some changes that I've seen, and I have to talk from COVID backwards because this is still impactful. We know that we're seeing a lot of emergency surgeries, right? But the volume is a lot less than elective surgery. And because of that, a lot of our technicians, no matter what their age or bracket, are processing less instruments, but reprocessing more durable medical equipment. They're cleaning and disinfecting and helping crises in different parts of the hospitals. And what that does is taking a skilled team that are trained for one particular task and forcing them to use different mental muscles. For one example is this: you can have a hospital that's used to having in 1 week 10 to 15 cold carts or exchange carts. Now, because of all the emergencies, instead of 10 to 15, they have 55 to 75. And one pull on resources that we failed to mention on previous shows was the resources or the shortage of demand for those items in those cold or emergency carts, right? Because you have all these emergencies, those resources are also being dragged and being utilized at a high capacity. So elective surgeries are down, right? Which is nationwide, but emergencies are way up. So the spotlight is once again back on that generational or that multitasking skill set. We've had hospitals, one example would be in Boston, where the senior members of our SPD team were all positioned just to hand out supplies and monitor supplies. Where a year ago, you would have never seen SPD involved in that supply chain at all.
All right. So with them, go ahead. Were you about to say something, Lila?
No, that was a very good point, because I know that I've seen a surge in more of the emergency airway carts and things that we actually support with the respiratory services. So being in my position, that education, there was a pull to get more people in that area than it was for anything else. When they said no hiring They didn't stop hiring in those areas. Respiratory therapists were still very well needed and wanted. So that's interesting that you brought that up, because that's right. We haven't really spent much time discussing those areas ancillary to sterile processing, but still depend on us to reprocess a lot of things that we do, like trachs and things of that nature. So.
Oh yeah. That Lila, that intubation equipment is enormous, right? It's small in diameter, but there's so much of it that has to be managed. And once again, our ER doctors, many folks in the ER they have had zero interaction with SPD until now. You see more ER doctors getting to know the SPD team because now they're a needed resource. But before, you never see an ER doctor hardly ever in SPD unless you have some joint committee meeting. So times are changing. SPD is once again back in the spotlight for a brand new audience.
Yeah. So Sharon, you said over the last few decades, and Wayne said once again back in the spotlight. So Florence Nightingale and I, we go way back because we in sterile processing, Florence Nightingale and nursing. So back in the day when we started, sterile processing actually reported to materials management because it wasn't even looked at as a clinical piece. So it's very interesting, and most of the people back when Florence and I started have retired. I probably even need to retire because we don't necessarily understand why it is the way it is today. So anyway, with that being said, it's really interesting to see over the years how sterile processing, as Wayne said, spotlight. We weren't in spotlight back then, but in the spotlight because sterile processing is the most important department in a hospital. So I just wanted to throw that little history in there.
No, that's valid. Look, Karen.
That history.
even the acronym ISHM, right? International Association of Healthcare Essential Sterile Materials Management. Currently have I gotta stop painting with a very broad brush. I know very few sterile processing managers that have actually worked in materials management, right? Very few. You have some. One example is Mr. Danny Vasquez. He transitioned from materials management to SPD. But just the acronym ISHM, it used to be, as you just alluded to, Karen, one department. All things reported through materials management. Now it's changing. You have some departments now. SPD is now reporting to infection prevention, which I think is interesting. Some are still reporting to the operating room, and are ran by a really good nurse who learned, in many cases, learned the hard way that SPD is not the OR. Different challenges, different set of mental muscle. So again, SPD is yet again in the spotlight, and we salute all of our SPD heroes. Every single clinician, every manager, every educator. We salute.
And Luane, it's funny you said that about nurses because back in the day, even though sterile processing reported to materials management, nurses ran sterile processing department. And it was, within the last, I'd say, 20-ish or so years that it was even considered someone that was not a nurse to run the sterile process department. So yeah, it's been an interesting journey in seeing how the mindset and even understanding the skill set, where the C-suite are more understanding the skill set, keep nurses, and I salute nurses that run sterile process department, but I know over the years I've mentored a lot of nurses that were put in the sterile process department because they came from, OR, and just assume because they came from OR, they would go in there and, as they say, change the things in sterile process. But you can't change what you don't understand. And so I'm happy to see over the years that the mindset has been to look at the skill set that you have that are in sterile processing and either grow them or that we take on that initiative to embrace our field and excel within it.
So I have a question. What since you and Luane and Lila, you in sterile processing all of the time, what major events do you think have happened to transpire those changes? To make those changes, going from being overseen by materials management is one, and then even being overseen by someone who was not, whose background was not sterile processing.
You know, I think it's because sterile processing is such a complex department. And I would say with the nurse theory, once the C-suite even started to understand there was a sterile processing in the hospital, because that was another thing that was always amazing to me. C-suite, they didn't know what the sterile processing was because they hired people, you know, which would be the materials management, vice president, or director. And so they knew that they were responsible for making sure that the instruments were in the room, but not understanding how these instruments were being reprocessed. And so I think as doctors started getting more frustrated with things not being right place, right time, you know, they started moaning and groaning more, which got C-suite involved. And so they had to show that they were making a change. And so then they started removing, some of these hospitals started removing nurses and saying, okay, we're going to bring in, you know, we're going to have someone that's maybe the supervisor that had been in sterile processing for a long time. So they promoted that person, but they still didn't give that person the tools, you know, to be successful. So now, okay, let's hire business managers and let's put these business managers over the sterile process department. So I think within the, you know, over the last 3 decades, as Sharon said, I think it's been a lot of, my opinion, has just been a lot of trial and error with C-suite, just trying to appease and not really understanding what they need to do. And today where we are, we're stronger. And so we're talking to them. Back in the day, you know, as a technician, you came in, you did your work and you went home and, you know, and just happy to have a job. And so now that, you know, we're more vocal because we're more in demand. That's what I think the change has happened over the years, that we go to the C-suite and we say, look, this is what we need. And then also with all of the issues that now you have their ear, so they're saying, okay, you make it a valid point, so let's move in that direction.
I also, well, go ahead, Lila.
Well, I was just saying, it's funny we're talking about this because I was having a conversation with a coworker last night, and basically it was just saying it's hard to play for a coach that's never played the game. And that's how sometimes we feel when we are managed by people who have no experience in sterile processing. So I'm saving that for my article. So this to let you know, expand upon it a little bit more deeper. But I definitely feel that I think that sometimes the pain of going through what we're going through, we're in a transitional period and we're all trying to figure out how to make things work. You got the budget behind you. You're trying to figure out how you're going to keep people employed. And then the demand hasn't changed, right? And if anything else, it's increased because now we're trying to keep up with this surge in volume. And I think that that's where the strength comes from, is that these leaders are sometimes in a position to try to coach us through something that they really haven't experienced for various different reasons. Whether none of us lived through a pandemic at this point, the majority of us in our area, in our field of expertise, and then trying to which seemed a little bit easier probably pre-COVID to manage a team. Now you're trying to deal with a lot of other issues going on because people have personal life decisions to make, and that affects the impact or impacts the hospital as well. So a lot going on.
I have something that I believe served as a catalyst, but I want to ask a little more specifically. You said the demand hasn't changed. I do believe the demand has changed, maybe not in the amount of people being demanded, so to speak. But even that, like the demand has within the demands, it has changed. Whereas again, you're doing more DME, you're doing more things that you weren't typically doing. So the demand.
Well, when I say demand, I'm
demand has shifted. Yes,
what you were speaking earlier.
And
I just wanted to hit that for just a bit because we serve. You know, I know this is going to go out, and again, that's what I love about the show. It's all different perspectives of the same thing. And I don't want somebody to be sitting on their laurels, thinking, well, nothing's changed, they're gonna call me. And it's like, no, you better learn some of those skill sets and how to serve those the ancillary, you know, like because that way it has shifted. That's a better way to shifted. So
I think sterile processing is one of those professions that's always in flux. You know, there's always something changing. And this is why this department was the best department to pivot in a time of chaos. It was organized confusion across the board because we're always in flux. I think some of the changes over the years, however, from materials management to the operating room to reporting directly to finance, SPD, the service we provide at this phase is not a billable procedure to most insurances. Right? Think about that. Think about if we were able to take those 3,000 trays your department did a month, and that cost will be associative to a patient procedure, right? So although our department impacts the bottom line of the entire entity, on the docket, we're not income revenue driven department. We just aren't. So I think some of that pull from materials management, everything in the materials management cachet, most of their products in stock that the OR uses can be billed back to insurance, billed back to the provider. Unfortunately, those filters you use in the trays, those indicators, the instrumentation, or that manpower is not billed back. And you see this reoccurrence happens time and time again whenever they talk about staffing. The moment they talk about staffing, depending on the department, what are they going to run those numbers against? OR minutes, right? And they want to run your budget against OR minutes. And they always get it wrong. The moment we start associating the OR minutes and OR productivity with SPD, you skip a whole dynamic that's even the smartest accountants fail to see the writing on the wall. There will be a day, however, that we must associate the function in SPD and be able to track and build it back to the patient in order to get an accurate measure on what true productivity is. Right now, assembly is not working, and we see this. This is why we have shortages across the country, right? Because their original model was broken. You go with a broken model, you're behind a 8 ball from day one.
Right. That's true.
Yeah. I wanted to put this in. We were talking about different changes, and Danny had asked a question. I believe visibility is what actually served as a catalyst or stimulus for some of the changes. And I'm thinking back to the 2020 expose with Sharon Golden, the past president, Sharon Green Golden. Thank you. But when that happened and 2020, that expose came, the appeasing became more than just the physicians during that season. Now you had to appease your patients before they were in the hospital. Because the information became more public, the infection rates became more public. And so I think that actually went into, this is opinion for those who are looking, I haven't researched this. This is opinion at that time, then the OR, because they were the ones who were getting credit for said infections. I just think some of the decision makers assumed wrongfully that because there's the OR, they would know sterile processing, or because they were receiving the instruments, they would be the better person to navigate and to oversee sterile processing. And that's what happened then. Like, so many people started asking questions that normally you wouldn't ask.
Right.
You would go in and you would have a procedure and you just listen to your doctor. Now you're asking questions before your procedure. Hey, these infection rates, and you have the ability to not go to a certain facility based on infection rates, whereas before that ratings visible, you had a social outcry like, what? These instruments are going in our body because it's on 2020. And I just think it like catapulted change. Unfortunately, and this may be the season where it changes, there wasn't a lot of trust in the SPD professional at that time as far as leading a department. That's unfortunate because they've been running it forever just behind the scenes. But now, and so I do. What do you guys think about that? I think that served as a catalyst. I would
agree. I would agree with a lot of that statement, Sharon. And one what I would draw from is this, right? You have a janitor, and what most people think of janitors, they just sweep up and mop, But if you have someone that works for the environmental care department, it brings a whole different avenue. What do you mean environmental care? It brings a scientific approach than just someone sweeping and cleaning. They have to know what are the contact hours of this chemical, what's the pH level of the water, what are health acquired illnesses. It's the same with a technician, right? Are you just a technician, or are you also part of the infection prevention team, right? Your training tells you how to break the chain of infection, the different portals and modes of viruses, so it brings a different light. And state by state, we saw the need go from just, I need an experienced technician and someone certified, rather than someone who just wants a job. So that visibility has transcended to a more qualified staff, more leaders, more articles, and greater liability. So that visibility, when I heard you say visibility, that's translated to me as liability or lawsuits.
Yes.
These lawsuits,
society.
These lawsuits started tagging the hospitals. They said, wait a minute, how come this person who has never played the game is running one of the most vital departments in the hospital?
Yes.
Yeah.
And that's when you see more you see the introduction of new committees that you hadn't heard before. You know what I'm saying? New committees. And so definitely, how about the introduction of the tracking system? Don't act like y'all don't know the
game changer.
It was a game changer. Not only was it a game changer, it was a good move. I think the introduction of the tracking system is good for definitely for the organization.
Yeah.
You know,
if you use it appropriately, because not every facility uses it to their advantage.
Okay. All right. And I was thinking the introduction, if you use it appropriately, because prior to, how
was it done?
Yeah, right. Certification wasn't mandated, and one or two people may know where all the instruments were or what all the instruments were, but other people didn't. And so you may be beholden to that person. If that person gets hurt, just think about all the inventory that would be misused or not.
Yeah. Look. Now, and I know we don't like to draw from politics, but this is just fitting right now, right?
Right. Go ahead. Yes.
Just a little snippet, right? The more, if someone said on some news show that we have increase in COVID case because we're doing more testing, right? We stopped the testing. That don't mean this is gonna go down. So I tied it to a tracking system. If you don't track the productivity, doesn't mean the productivity is not being done. It's just not visible. It's just not traceable or trackable. So the tracking system actually gave more credence to how hard this department works day in and day out, and how much activity is missed. There's still no tracking system that I've ever used that can measure every step of the process, every step from not just from trays and operationally, but from the spot maintenance, all of the transportation, the customer service. We say first shift puts out fires. I never saw a put out fire measure on any tracking system, but ask someone who works in a department what that means. They can give you an entire denominator and explanation on what that means. So I think tracking system was a part of that visibility.
Has the introduction of the tracking system reduced the need for FTEs? Like, has that replaced FTEs in the department?
No, I think it helps. I think it helps you give you the option to increase your FTEs and show.
Because you get
metrics to show what you need FTEs for.
It helps validate some of the
quantitative data. It gives you the hard data that you need for people who, if your conversation game or if you're a relational game, if your facility can't see why you need extra FTEs, the tracking system will help there. The tracking system will also help with your budget if you're spending too much money on purchasing new instruments so that you're not caught up in every shiny new object.
And it also helps. Yeah, and it also helps validate whether you need to or not, because you can pull the history of the usage of those instrument sets.
I think
like Lila said, if you
make decisions quicker. I'm sorry, Carrie. What did you say?
Like Lila said, if you use the system correctly.
Yeah, and so these are. I'm just saying, like, these are some changes, and what I really, there's so many things we can take, so many nuggets we can take from these changes. One of them is the changes in the way that they were implemented 30 years ago, like even the time process to be implemented. You know, it was a longer process. Well, what about this? You know, because you're changing tradition, changing status quo, and with technology coming, changes are happening, you know, faster. So what we were doing 7 years ago, where some facilities are just now starting to do it, I'll say 10 years ago to be fair, something that was introduced 10 years ago, some facilities are just now like, oh, there are really some facilities that still don't have a tracking system, you know? And they're like, oh, we're going to get a tracking system.
Right.
And and then you get this system, and the system you have is now antiquated as far as software. And so that's what I'm saying, like operational changes and how people are, how fast it's happening now. And then if just for a moment, if I can take your mind and push it to how fast it's going to operate over this next decade in the 20s. We're in 2020 now. So we're at the beginning of a decade. And some people are still moving at the pace of 30 years ago, whether that's operationally or just as someone that's a part of the workforce. So what are some of the changes that we see that are, I know I have some, but I'm asking you all, what changes do we see coming?
Well, ask a question as far as from the hiring perspective. When someone doesn't have experience with a tracking system, how likely are you to place them in a facility that, you know, has that as their crutch? Because I know how I view it, and I definitely kind of put that as a strike against someone who's never used a tracking system. Not to say I can't coach them and train them and how to do it, but I definitely go, do I want to put this time and resources into training someone who has never touched a tracking system, only knows paper, as opposed to someone who has at least maybe less years of experience, but has used a tracking system in those less years? And I'm just curious to find out, because I know how I feel about it overall, but I'm curious.
Well,
wow, that's good though, Lila. That's good.
Yeah, I don't believe all SPDs are equal or created equal, right? So you have a city in Anaheim, California, right? Huge system versus a hospital in Bethel, Alaska, right? All patients matter, right? All patients matter. This hospital in Bethel, Alaska is, 1,000-bed facility, rural healthcare, community healthcare, no tracking system, infection rate is probably comparable to that big hospital in Anaheim, but a different population. If I was on that account as a consultant, would I recommend a tracking system? Every time and all the time. But due to budgetary constraints, cultural norms, it might not be a good fit how we see a tracking system. So I don't think all SPDs are created equal. I think all patients matter. I think all patients' health matter, period. But depending on your population, the region of the country, there are some differences. And some differences are even scientific, right? If you're working in the mountains somewhere in Colorado, you may have a humidity problem that you simply can't get the trays or your environmental department and your units to fit what you're used to working somewhere in the lowland. So I think those are some of the changes and shifts we have to consider. There's no such thing as a universal IFU, right? A manufacturing can write an IFU, but if you don't have the equipment to meet final rent purified water, right? Now you have to get distilled water. Guess what? Distilled is not purified. Those are quite vastly different components. So I think those are some of the challenges. We're pushing for universal health care. I would love to see every SPD department. We do have a baseline standard of care, clean and dirty, assembly, etc. But many components are missing, right? Many rural hospitals don't have one source. right? Other hospitals where I think one source is some are just now beginning to follow or attempting to follow the IFUs verbatim, you know. So it's gonna be interesting, you know. Sometime, you know, me being from New York City, I tend to see things that everything is as it is New York City until I got hit with the shock. Like, wow, there's a little community hospital. They're writing everything by hand. They don't have they never heard of a case card, but the infection rate is extremely low. So I think there's a give and take.
It's a good point.
Okay. All right. I hear that. You know what? Maybe we should. I'll look at that and see like how many hospitals are here, because I also think that puts that hospital at a disadvantage in the time of business people now, and where physicians are having their own ASCs pop up, different ASCs who can do some of the procedures. Now, maybe some rural areas it will only ever be one hospital, and they don't have to change as fast. But for revenue purposes, it could be viable, you know. That's why, okay, another change. Over this past decade, how many hospitals did we see coming together and creating like their own system so that they could stay part of the healthcare system?
Yes.
Hospitals are closing. No shade. Hospitals closing like laundromats. You know, people getting their own washers and dryers. They're going a different way. And so within that construct, you're right. There is humidity problems in certain areas. There are things. There are all factors. None is created equal. There is no, you know, universal IFU. I also submit to you, though. I also submit that there are some hospitals who may need to make a change. Sometimes just because if it ain't broke, don't fix it. It is broke. It's limping. It's on its last leg. And so why don't you put some life into it so that you can sustain the life of that facility and even of that community if you employ a lot of people within that community.
Right.
Many times, you guys, hey, we've all been on the road and we fly somewhere that you have to drive to. You then you have to drive a couple of other hours to get to the to get to the
airport. Yeah.
Into it. And how many towns do we pass? You know,
Right. No.
you know, you don't even get a ticket there because that's the only source of revenue for that said town. So,
right. I think Sharon, when for instance, we look at our past 10 years, scopes have always been in the spotlight, right? And the reason why scopes are always in the spotlight, we still don't have 100% compliance of scopes that can be sterilized, right? So, and this is coming down to sheer economics, right? We have a body in the government named called the FDA that could absolutely mandate universal decree that all scopes must be sterilizable. Do you know what that would do to the scope industry, to the amount of stock that has to be converted or retrofitted for sterilization? It'll bankrupt a multitude of companies and hospitals who acquired this stock. So these decisions that we speak of are not just operational, not just political, economical. There are so many stakeholders at these tables. And the unfortunate part, SPD, although we are a stakeholder, we're not, we may not be at the big table. You know, we may not be at the big table.
All right. So I'm going to go. Let's go ahead. We're going to take a commercial break. And then when we come back, we've talked about some operational changes. I want us to hit briefly on the capabilities, like what the capabilities are with automation and with outsourcing, if you have some feedback there. If you don't, no worries, we'll go right on, because I want us also to hit the changes within the staffing models. Like I know that there have been some operational models when we talked about it, going from materials to now we report to peri-op services, surgical services. Maybe the philosophical why behind that, the addition of more and more tracking systems, us doing more DMEs. Like we've seen some of the operational changes and the speed of said operational changes now. You know, this people are implementing stuff fast. You still need a timeline, but they're making decisions faster. And so I want to look at that as it relates to staffing too. But when we come back, if we could just talk about some of the things that may have to do with operational models for the 20s, not just 2020, but for the 20s. So I'm going to pull on your brain power a bit. Speed of technology, COVID-19 coming in and saying, yeah, shake it all up. You know, like what are some operational models that we may see over this next decade? So as we come back, we'll get right into that.
Yep. Sharon, you're muted.
All right, there we go. Hey, good looking out. I was just saying, I'm Sharon Combs with Knowledge or Nonsense. This is what we actually talk about, what's knowledge and what's nonsense. And we really try to vet the process. Right now, we're going to look at some of the operational systems that we're projecting and we're forecasting for this decade that we're in now, 2020 to 2030. What are some of the changes we may see? And what are some of the capabilities of things like outsourcing, automation?
I'll leave that to the experts.
All right.
I think one change that is already taking place and will come heavily is additional pathogen and biological testing. Not just, and I'm talking about additional swabbing, additional protein tests. Many measures that your infection prevention department would come through and perform on behalf of SPD, especially during a mock survey. I think a lot of those functions are going to be shifted to SPD as a core measure, because we're living in a time of so many unexpected. You know, we're facing COVID, but everyone's thinking, what's next? So we have science and these creative minds putting together tools to be able to capture the what's next. So I think more testing, more qualitative tools that can reinforce the infection prevention part of our task in the cell processing department.
Yeah. And I think as far as the expectation of the people working in sterile processing, you know, years ago, it was that I have all this experience, but, you know, you've only worked in one hospital for those 30 years, and that hospital may not have had a tracking system, or that hospital may only had, you know, done the sterilization piece and not the reprocessing or whatever. And so it's that you're going to be expected to be certified, to stay current with what's going on in the industry, because it is, you know, a business. And for hospitals to survive, and not even just survive, to thrive, they're going to need us to be able to be those experts at every level within the department, not just the responsibility lying on the manager.
Yeah,
Yes.
I would totally agree with that. I think the scale, another change. I think that the task force or hiring pool, we're going to be hiring a lot more smarter people. You know, people who have multiple skill sets. Not only your resume should not only say I've been at SPD 20 years, right? And in that definition of being SPD, as someone hiring, I only see you within the confines of sterile processing. And when we just spoke about how many of our sterile processing colleagues had to shift or pivot to assist other departments, but we want to know now, how well do you really work with other departments? Have you ever worked in a clinical setting? You know, do you have experience with customer service? All of those, you know, points that normally on your resume, they may be under extracurricular activities. Guess what? As a hiring manager, I want to know what are those extracurricular activities to identify a skill set that you can bring to the workplace.
I just want to weigh in right quick. Definitely like transporters. You know, I know there are people who've been like, the one you mentioned, New York, you know, New York transporter is a position that is, it's more transporters probably in New York than there are maybe in Oklahoma City. And so like, if that's your only skill set within underneath the SPD umbrella, you're like, well, I'm a transporter. They're going to call me and I'm going to, you know, take the instruments here. I just want you to know that they have diesels that are driving themselves on highways now. So please know that I feel like transporters, that job, you may have one or two people to oversee all the transporting. Yes.
Yeah.
You won't have those transporters because software is going to be able to automate that. Software is going to be able to say, hey, this needs to go to room 1, this needs to go here, and that's going to be able to happen without a person.
Yeah, and Sharon, that's happening now. Yeah, there are some facilities that have that.
Yes.
Yeah. And then I look at oh my gosh, I'm not going to say the name of the facility, but in Boston, you know, they have so much automation, and it's good for the hospital's bottom line. Maybe it costs them some more money at the beginning to implement, but like work hours, overtime, like certain things, like that used to be a person doing that, and now automation is doing it. So like, yeah, definitely, I would say if you're a transporter, please bring some other skill sets within what you're doing, within what you're transporting. Find out about what you're transporting, so that you can still have a spot. Donnie?
What, Lila, did you want to say something first?
Well, honestly, I just wanted to say that from my experience of right now, just being in on the designing of future SPD departments and facilities, and having that experience, automation is key. I don't know of any bids from any of these top equipment companies that haven't included what automation is, what our automation systems can do for you, from decontamination washers that are automated to sterilizers that are automated. So what I find the issue with that is just that it's great. It takes a lot of ergonomics off of the body and the stressors off the body. So looking at it from a training and education piece, it's an interesting application to add to the overall process. You know, for those of us who were hustling and know what it feels like to drag case carts all the way from one elevator and bring them down to decontamination and unload, that aspect of it helps, you know, the wear and tear of the body and the daily grind of being in a tough area, because we're talking about lifting heavy trays. Orthopedics, we all know how it feels to have to pull those trays and disassemble them and put them in sinks, and once they get in water, they're even heavier than they were before they got in there. Trust me. So I feel like those automation changes of the future are really going to be great and impact a lot of the wear and tear and help with our, you know, overall care of ourselves and our bodies. You know.
Yeah. So I'm going to piggyback off of Lila and Luane's. So with the automation, though, it does create the need for fewer FTEs in the department, because so many things can be done without needing someone transporting or pushing things into the washer, sterilizer, whatever, because those things can be automated now. And then from an administrative standpoint, you're also taking into consideration the savings with long-term disability. You're thinking about workers' comp, all of those savings that are go in conjunction with as ergonomics improve throughout the facility, and the reduction of FTEs needed to perform these daily tasks. So this is why it's the opportunity for people to take advantage of determining what outside skills they want to acquire to be able to accommodate the automation that's coming into play. Like, you can't say this is the way we've always done it, the way we do it forever, because as you see it's changing, you're going to have to learn how to touch a keypad. You're going to have to learn how to read and understand what some of the graphs are saying and different things along those lines. So this is the time for you to figure out what around your transporting, since transporting was the model we were using for staffing. What can you do to say that I am the absolute best transporter that you could ever hire in this facility? because along with my transport. Oh, go ahead. Sorry.
So Donnie, what I hear you say is no one's going to be interested in you saying that's not in my job description.
Correct.
When you're looking at how you can say, or I did that last time, or you need to find somebody else to do it, or I'm gonna not go to work today. I'm just go to the beach because it's a nice day. Is that what I'm hearing you say? That
because those are the true factors that we're facing. Because like not only are the staff facing COVID, so is the administrative team, so is the CFO, the CEO, all the doctors, everyone. So when you decide to not call in, they're not looking at it as I bet they were having a hard day. They're looking at all of the things that impacts everything it affects. So then that impacts the future decisions. And with future decisions, if you can have software that can do those tasks, you don't have to worry about someone calling in. Your software is going to work.
Yeah, and what's amazing, Donnie, is that the future is now, right?
Yeah,
and that's how we're doing this.
Many of these virtual management tools here at CS Assist we already have. So we welcome you to have this conversation with us. And it is time to step your game up, right? Again, no, all SPs are not created equal, right?
Correct.
But the outcome must always be a positive outcome. That's your role as the administrator, the CFO, or an entire C-suite. You need positive outcomes for sustainability of your brand and your business.
Mm-hmm.
Yes.
Yeah.
And so, for those of you out there, directors, CNOs, CFOs, CEOs who are listening or this comes across, CS Assist, #1 online resource and a sponsor to UCDI leadership. So definitely you want to look into that. For those of you who are within the workforce, I would encourage you to watch a movie called Hidden Figures. And there's a segment in that movie where the computers are no longer going to be needed. And the woman goes in there where the IBM machine is, and she's like, no. And she takes the initiative on her time and on her dime. She goes to get this book and learns Fortran and learns about the IBM machine. And by doing that, she secured a place for not just her, but for her entire team to be able to have a place to work moving forward. And so that's all we're telling you. Look at that again and look at it from that measure.
Yeah, and I'll say that CS Assist is a great place to find additional educational resources for things like that. There are always there's a webinar going on for any technology coming into the department and the things you can do. So that's a great place to always find something to improve your skills with what you're doing every day.
Right.
Yes.
Assist,
And
right?
Say that again.
What'd you say, Lon?
Oh, I said it's in the name, assist. So
Assist.
Yeah, assist. You're right.
It's the ultimate assistant. Yeah, they really care about SPD. Like they care about the whole of SPD. A lot of times, most of the SPD people care about SPD. There's some people who come in just for the buck or just, it's a buzzword now because COVID has shined the light on us. I don't think the light will ever go because there are going to be other pandemics and other things with infection that are going to require different levels of sterilization. But before we go to our next break and then we finish up, I definitely want to, Lila, if you can help, we have somebody named Kashan Patel. Now, Kashan, disclaimer, we're not in India. So if India has different regulatory restrictions or regulatory requirements, we hope that you know those. But he's saying, how do you handle COVID patient surgery instruments? And I know you had said before, about the drills. What would you say to him?
That we're handling a virus that is no different than anything else that we've already dealt with. We are dealing with coronavirus. And so your standard precautions, everything that you do should be still in place. So and I agree with you. I don't know what standards you follow. So if you're under AMI guidelines or other international guidelines in India, I would definitely just follow your same rule of practice of what you've already been doing, whether it's MRSA, HIV, any type of infectious disease. Once those instruments come to your decontamination area, I expect for you to handle it the same way appropriately as you would go through. So handling of COVID patient surgery instruments, I think this should be done the same way. I've seen a lot of hospitals, as we say, pivot during this time and maybe change some of their transport policies and things of that nature. But again, it should be handled the same way. We should be, whatever issue that however we transport, if we want to transport things within an hour, that should be the standard rule, golden rule. If it shouldn't change just because of a COVID positive patient being in surgery. So I hope that answered your question. I think we had spent some time talking about this way back in April. So I would kind of encourage you to kind of view some of our past shows of this nature, but and then there's some information, and I'll try to find some other things that I can find. I think it's an interesting article from one of the that was posted up on one of these chats before, and I'll try to repost it today so that you can see what other hospitals were doing. But I can honestly give you my feedback would just be to continue handling as you've been doing it.
Absolutely. And, yeah, best practice protocol, and know that many of us hold a certification that's an international certification. So in that certification, where you learn the chain of infection control and how to break that chain. So there's a ton of resources, too many to list right now. But please, if you can provide your email or some contact, we can give you some awesome tools that will cover or transcend international borders. Because the virus that we're facing in America is the same virus you're facing in India, right? So we'll be happy to support you, Kashawn, and thanks for jumping on our feed today.
Absolutely.
All right. So what we're going to do right now is we're going to take a little break, and then we're going to come back and quicker, because we only have about 10 minutes left. We're going to talk about the changes that we can expect as it relates to staffing, as it relates to how people get employees and how employees get employers. And so when we come back, if you guys will be ready, we're going to go over some of those things.
At SIPS Consult, we understand that these are changing times, and these are times for unity. SIPS Consult would like to extend complimentary sterile processing, consulting, and educational services to support your sterile processing department needs during this COVID-19 crisis. Everyone is aware that things are extremely challenging right now. We want to personally thank you for caring for our communities. We appreciate you. We appreciate you being in this fight for us and with us, and remaining on the front lines. In an effort to provide SPD support during this time, we have created a non-automated 24/7 complimentary helpline with subject matter experts to support your department. We encourage you to call us with any sterile processing questions or inquiries. To speak with one of our dedicated consultants, please call us at the number below.
All right, and we're back. Definitely want to say I put CS Assist in the background there. I'm so appreciative of both SIPS Consult and CS Assist for sponsoring this forum so that we can ask the questions that need to be asked, get the information that needs to be received, and just break it down. Really look at the information and break it down. As far as the upcoming changes, things that we may see in this decade, one of the things we didn't talk about was the increase in off-site management, where even though things are going on site, there's an off-site management component to it. And so I do believe that's something that's going to be a very real operational change coming up. So let's talk about the staffing component of it. And not just staffing. Staffing makes it seem like, you're getting texts. Just all support staff and the employment partnership. What are some of the things we already see? Whereas before, go ahead, Donnie.
For me, I think, and again, since we're all talking just from our personal perspectives or thoughts on it, opinions, I believe that a lot of redundant tasks will be automated out. And that'll be from some scheduling components, that may be from some administrative, like patient check-in, that could be from even receiving and delivery in departments and hospitals. I believe those things will be impacted drastically over the next 10 years as those tasks are able to be automated as software improves.
Yeah.
What about by the means of how we how we attract and retain staff? Like, there's been a lot of third-party agencies, and
Mm-hmm.
I think that will continue, but I think it'll be heavily restructured. There's some processes that are like labor intensive on the front end, and I just see some changes there with people not maybe wanting to go through those agencies.
Well, I can tell you this. I've worked with SIPS Consults for many years, and now through CSSS, it's about company culture, right? Now, there's no shortage of qualified technicians on the field, but there is a shortage of companies that value their technicians and managers and don't use them as a disposable commodity. You're not disposable. You're invaluable, and you need to be with a company or a team that treats you as such. So that's what forms a happy marriage. And many hospitals have been put on notice, right? Whenever you see you're a manager or a technician, go across the street. In some cases, not even to make a dollar, that should tell you something. It's more about environment, company culture, and that they truly matter. You also asked about outsourcing, right? Companies such as SIPS Consults are positioned to carry that burden, right? This is the true definition of specialty. We want you to focus on what you do best and allow these specialists to focus on what they do best. And in the interim, we have positive outcomes for the community that you serve.
Mm-hmm.
Right. I agree.
Yeah.
I think too, like with different human resource departments, do you guys see changes in human resource? Like there are a lot of facilities who historically have trouble getting support staff and keeping support staff. And do you see changes within the approach that the HR is taking and how they are filling certain specialty positions? Not even just through agency, but just permanent positions. Do you guys see changes with that coming up over this next decade?
It's like LaWayne just said, you have to consider your staff. You have to become more inclusive of what people really need to feel like they are important or to understand their importance in the organization. Because everyone does play a part. And whenever you treat people as if they are disposable, that impacts their performance. So you have to take into consideration every single role, like no one is greater than the other. So you have to consider those things and then inform people of how their actions impact the entire organization. Because when you empower the team, it empowers the entire organization. So becoming inclusive is very important. I do see people really going towards that. And we see it even as HR. Now everyone is doing like the DISC assessments or what's your animal, what type of management style do you have? What are some of the other things? And people are big on company culture right now. Everybody, since Google came out with humongous slides and beer pong tables, everyone feels like they have to try to incorporate something to compete with that. And your organization might not even be able to do it, but there's something you can do to make your team understand where they fit in and the importance of them being part of the team.
And relationship on both ends. In order for you to be successful, you have to have those relationships, those partnerships. As a technician, you're a partner. As a manager, you're a partner. As the owners of the company, those are your partners. As the leaders of the department, those are your partners. And Sharon, before we get off the air, I want to take 15 to 20 seconds to tell Mr. Jeffrey Davis how he can do real-time roadmap.
Yes. All right. No, excellent. We can actually
I just wanted to add my 2 cents because I think that's a very valid. I love what he asked for, the real time. But I just wanted to say, pay attention to how people treat you. I know I said that before, but this is the time to truly pay attention to how you're being treated by your employer. Because what I hear from staff that I work with is that being on the front line has been very weary. We've all been in a position where we didn't get that opportunity to go and stay in that quarantine for real and spend time with our family, because we were expected to continue to come to work. We were expected to continue to show up and do what we were supposed to do. And so, and now that we are still faced with the fact that we have no idea when this is going to end for us and when it's going to stop, people are faced with the reality of trying to figure out what I'm going to do with school. How am I going to, my family now has to divide into who's going to be the stay-at-home monitor of the virtual schooling process,
dealing with it
who's
now.
going to continue to be the breadwinner and go out and take care of the family. So I think that if your department hasn't addressed those issues or made a real statement about what they want to do to help that culture, help people really get through this pandemic, then you're going to start feeling that groan on the back end. People are going to maybe start voicing that issue of, well, maybe I'll go somewhere else where I'm a little bit more appreciated because I need more support outside of my work environment. So
and bear in mind, sterile processing, as LaWayne said earlier, has always been a department in flux. The difference now is all other departments are in flux as well. All other systems are still in flux. A lot of these needs, as Lila is speaking, these are immediate needs, but a lot of people will not make an immediate decision because they don't know what they're immediately deciding on because they're still in flux. Just speaking from an organizational viewpoint.
Yeah.
You can't really put a policy or something in place long term, like this is what it's going to be, because things are still changing. They're like, can we do elective? Can we not? And so it's flux, man. It is real flux. And now we're going to talk about these real time, the roadmaps. Before we get into the roadmap, one of the comments said that they believe a collegiate component needs to be added to make it financially rewarding. I want to say that I agree. Now, there are fields where you can have a very financially rewarding paycheck or compensation packet, and it doesn't require, a college degree. However, there's going to need to be something that's more than a triple crown from Isham. I know we're talking about a triple crown from Isham or CBSPD, wherever you're getting your certification. I know that what we do is crucial and very important, but you have people who are going to go above and beyond, and you still have a lot of people who are like, that's not in my job description. And whether they know it or not, every time that statement is made in a negative format, like I ain't doing it, even though if it's right here and you can, that undermines the overall push of the SPD nation to get these financial gains that we're saying, no, hey, this is our critical thinking skill level, and this is what you pull on. And so there needs to be something. There's going to have to be some type of certification, some program. That's one thing about one of my sponsors, again, and I'll put it out because I work for SIPS too. And I'm so glad I had that opportunity to do that. But one of the things I can say without a shadow of a doubt is SIPS produces leaders. Say what you will. SIPS produces leaders. Everywhere SIPS went, people, hey, come to our team. They want to take the individuals because of what's being invested into the people who are working, and we need that to permeate the entire field, whether it's via SIPS or not. That type of leadership, that type of responsibility and understanding why we do what we do as partnership, as she was saying earlier, that has to permeate the entire culture of SPD Nation.
And people, this is pandemic time, people, and like Sharon said, hospitals are closing. So, and that's why I said it's a relationship, a partnership. It's not just what you can do for me, and if you can't do it, I'm walking out. You have to realize it's a marriage, it's a commitment. So you talk about it and you try to work it out. I think about back in the day. I remember one time interviewing this one young man, and he said, "Well, how much are you gonna pay me?" No. It's a relationship. You tell me what you're going to do for the pay. We want to pay you well, but we also, as a relationship partnership, we don't want that to be the first thing that you're looking at, because you won't be successful if all you're doing is chasing a dollar. So think about this. It's rough times out there. So what can you do? What can you do to make your marriage, your partnership, the best that it could be, before you just get upset about a dollar and walk off, or because somebody said something that hurt your feelings? It's a tough world out there these days, folks, and I think we're going to go through this for a while. So let's grow. Let's grow.
Let's grow.
So vital what you said, Karen. I can tell you, assist. We're not interested in hiring any solo acts, right? We're not interested in hiring anyone who think they can do it without a team, right? We're growing a team, looking for team members who know or know how to function on a team as a team. That's the only way forward. This is a holistic approach. When I say holistic, we take into consideration all of those external factors. We know you have to stay home with your children if you're in that circumstance. And so we'll try to pivot to adjust your schedule as much as we can to support you. So you need to take a really deep look at the organization you work for, and you make the decision if you need to find a new boss. And if that's a decision you need to make, know that not telling anyone to quit their job. I'm telling you to set your roadmap, get your stakes prepared, and use some of the folks on this panels as some mentors to help you with your.
Yeah, absolutely. I want to go back to sharing with the collegiate component. There will have to be something just to validate people's comprehension. As Luane spoke earlier, there is no standard SPD across the country. There are other variables to take into consideration. So just having some critical thinking skills, being able to do some research, reach out to additional resources to identify problems that you can't just find by sticking to a standard from what you learned somewhere previous. You do have to be able to use critical thinking skills in moments when something wasn't already laid out or prepared for you. So that'll be a very, very invaluable tool moving forward, like a skill set to have.
All right, we're a little over. I just want to sum some of these things up because we're going to do this. We want to definitely respond to Mr. Davis, Mr. Jeffrey Davis. I wish we could bring him into the back room and talk to him a little more. I am familiar with Jeffrey Davis, but some of the changes operationally, DME, learning things that are ancillary, reporting. Our reporting structures are going to change. We're looking at some software, outside management, automation, outsourcing. These things are going to come more and more. If you're holding on to a model from 25 years ago, I want to encourage you, let that go and swing that hand and put it underneath a book or hit a keyboard on YouTube and learn something.
Yeah, all sorts of resources.
And be a part of this. Also, I want to say what Donnie just said about there are more components to it. Your relational ability, your communication skills, and I'm not talking just that blanket communication skill that people do once a year on a PowerPoint. No, your ability, and that's what UCDI leadership, that's what we do with the DISC assessments and helping people know who are you hiring, how to best communicate with them. Communication is about others. If you still focus on what only you're saying, you're missing the boat. And so there are different components and soft skills that go into actually being able to effectively, critically think and impact the team. So I wanted to just hit those bullet points because that's everything we've gone over today. Real-time roadmap for a 25-year-old that wants to fulfill these potential opportunities. We're going to keep this within sterile processing. First thing I would say, you have to know what sterile processing is, and go, panel.
So I'm going to say, because I was that 25-year-old and started sterile processing, and so if you these days, if you're on a sterile processing and you want to get in sterile processing, and I can speak from what we have a 10-week course, and then we get you into a hospital to get your 400 hours. And because we really take pride and invested in you to be the best you can when you get to that hospital, 95%, we have a 95% rate of hospitals that hire our employees. And so with me, the real time was I got in there, I embraced it. I became a supervisor, then I became a manager, then I became a consultant, and today I own the company. So that was my roadmap in a nutshell.
Mr. Davis, I want to share with you, I want you to be hungry. I don't want you to settle. I don't want you to take no for an answer. I want you to know that you are important and there's resources out here, right? And what does hunger look like? Hunger looks like if you only put in one application a day, you need to step your game up and put out 10, right? If you don't get a response from the application, I want you to call the hospital. How you call a hospital? Google the hospital number. Start at the front desk. No, it's not in all these cases. It's not who's smarter. It's who's hungrier, right? And your hunger and your aptitude to get past go is gonna get you in the middle of the race. So get past go. Be hungry. Get hungry. There's tons of opportunities. The folks you see presenting here just represent a small group of a whole plethora of opportunities. Represent the best of the best, but just a small group of what's out there. So stay hungry.
Hungry and humble. That's my word. Be humble with your hungry though.
Okay.
Yeah. I'm gonna. Oh, go ahead, Lila.
No, go ahead. I'm sorry. Go ahead.
Okay. For me, I'm gonna say take on those tasks and projects no one else is willing to do. As you go through your career, those are where you really learn the lessons. So if there is anything going on, you more than likely won't be compensated for participating in an additional committee team or anything, but the things you can learn about your department, all the ins and outs, all the intra and interdepartment workflows and changes that are happening in the department, those are the things you really want to make sure you participate in along your path, because that's what you continue to add to your resume. Because you continue to add those things to your resume, and the knowledge behind it is what something you just can't get in a textbook or anywhere else.
Okay.
For me, I would just add in, I definitely believe in manifestation. Speak what you want into existence and build your network. Speak to people. You're not going to find out about a sterile processing job sitting around talking with people who working at McDonald's, because they probably don't know where the jobs are for sterile processing. So you build your network, get with like-minded people who want the same things that you want. Join a chapter, join, there's resources out here. If you're on this group for sterile processing professionals or any one of those groups out there, there's several of them, follow them and see what they're doing. You build your network of people, because that's when you'll find out about the jobs. And then you'll start building friends and colleagues that will let you know when the jobs are available. People ask me all the time, I'm like, we're not hiring, but so-and-so is. And this particular facility is looking for this. And, so because those opportunities come my way, I pass them on, I share them all the time. So continue to say yes. I agree with everyone here. Say yes to opportunities. Go put yourself out there and be accessible. So because when the job does come your way, you don't want to miss it, because you're no longer checking your emails or on your on your LinkedIn page or whatever. Be accessible to people so they can find you.
Go ahead. Go ahead, Donnie.
I was going to say, preserve your brand. Like Lila said, you have to make sure you always work with integrity. Even as you build your team and resources around you, people that could refer you, people start to disassociate if you do not work with integrity. So make sure you do everything with great integrity, and always think about your brand and the impact it has on you and those you associate yourself with.
I was going to also say, get your top 5. If your goal is to be an SPD manager, someone in your top 5 must be an SPD manager. You have to have in your corner, in your core, someone who's already there where you want to be.
Trying to go, exactly.
So build your top 5.
Yeah, and no shade against McDonald's. I'm just saying that, because I know some people who have some very good careers and moved up and own a McDonald's. So, but I'm just saying that if you
they coming for you, Hala.
I don't want that backlash.
I
know. I want to weigh in too, Jeffrey. I would say let your decision making. I like to speak in like parables sometimes, but let your decision making take place in a gated community, which means if you right now where you are, if there are individuals around you who really can't speak to where you want to go, then don't open the gate for those conversations. But get you some mentors or people who, like, if you're the smartest person in the room, get up and move rooms so that you can open your gate and get some new information to help you move. LinkedIn, you want to make sure your profile is up to date. You want to keep your profile current. That goes with what Donnie said, is in building your brand. A lot of people on LinkedIn, they so connect with a company or who they work with, but LinkedIn goes with you even if you leave that company. So you want to keep your LinkedIn up to date, join some groups in LinkedIn, read some of the articles in your field, even contribute some articles, get on some groups on Facebook. It doesn't mean you have to weigh in a lot on Facebook. I recommend be mindful with what you say on Facebook within those groups, but you'll be able to see what are some of the pain points in the field that you're looking into. You'll be able to see what are some of the pursuits and what are some things that separate you from the pack. If you just watch what people are talking about and see where those pain points are and bring solutions to them instead of just water cooler conversation, you can Google open positions and the regions they're open in, and that's going to let you see what the pay is like there. So when they ask you, what's your pay range? You're not like, well, I don't know what my pay range is. Go ahead and say something. They have a pay range. It's okay for you to say one too. It's all right. And so they just let you know there. Also, wherever you apply, take 5 to 7 minutes and find out about that place you're applying at online. Take
prior to the interview.
Learn their mission statement, find out what they love, what drives them, because you're partnering with them. Why you want to marry somebody and you don't even know their last name or their mama name or nothing like that? You have to find out about who you're partnering with. And then the last thing I would say is, well, 2 things. Reverse engineer your goals. If there's a certain financial amount you want to make, or if there's a position or there's something you want to be able to do, start from that place and then back into just reverse engineer that goal. What's needed? How is it needed? When is it needed? Who needs to know about it? Reverse engineer where you want to be so that you can, when things get crunchy or when things get like COVID-19 everywhere and your brain power is going to other places, you don't have to spend extra mental energy on what you've already put in place. James, I like what James says, learn every stage of the department. If you can't take some of the courses, he said, look at Cornell, Harvard, because they have certifications, courses related to infection control and patient safety. Do that. YouTube, lane specific study on YouTube. I'm telling you, everything from tying shoes to learning how lumens, everything is on YouTube. So there are tools out there for you at different cost levels. And then, of course, the last thing is reach out to UCDI leadership, because this is what we help people do all day long. And we help you find out even about with the assessments, what may be best for you. And so I just want to say thanks, guys. This has been a longer than normal show, but I'm glad we were able to get some answers out. If you have any questions, please just send them to info@UCDI leadership. If you want to connect with Mr. LaWayne Perkins, again, on LinkedIn, use LinkedIn as the source, as the resource that it is. LaWayne Perkins is on there, Karen Cherry's on there, Donnie Payne's on there, Lila Price is on there, myself, Sharon Combs on there, and let us know, because we're here for this. This is knowledge and nonsense. We want to be sure that the people within SPD Nation, CS Nation, our communities are moving forth with knowledge and letting knowledge move you to decision making and not nonsense. Just because people did it before you doesn't mean you need to be the 21st. Find out what it is, vet the processes, and let's move forward there. Thank you all so much for being with us on Knowledge and Nonsense, and everybody have a great weekend.
Thanks. Do the same. Thank you.